So, this is a very good morning. Good morning, everyone. Thank you for joining us today as we are celebrating a remarkable milestone in our healthcare journey here in Dufferin-Caledon and at Headwaters. I'm Kim Delahunt. I'm the President and CEO here at the hospital, and I'm going to be your MC today. As you all know, today marks a very significant accomplishment for our hospital and the communities that we serve. After months of hard work and dedication, we are thrilled to acknowledge this major milestone that will bring vital MRI healthcare technology to Headwaters. First, I'm going to begin with the land acknowledgement. We would like to begin by respectfully acknowledging that Dufferin County resides within the traditional territory and ancestral lands of the Teonatati, Attawandaron, Haudenosaunee, and Anishinaabe peoples. We also acknowledge that various municipalities within the County of Dufferin reside within the treaty lands named under the Haldimand Deed of 1784 and two of the Williams Treaties of 1818, Treaty 18, the Nottawasaga Purchase, and Treaty 19, the Adjutants Treaty. We also acknowledge the land which forms the town of Caledon is also part of the traditional territory of the Huron-Wendat and the Haudenosaunee peoples and the Anishinaabe of the Williams Treaties. These traditional territories upon which we live and learn are steeped in rich Indigenous history and traditions. It is with this statement that we declare to honor and respect the past and present connection of Indigenous peoples with this land, its waterway, and resources. Our hospital is also so fortunate to have such tremendous and beautiful gardens, of which we're in one this morning, that are all lovingly cared for by volunteers, and I'd like to acknowledge this land as well. So this morning, please join me in welcoming those who have played a pivotal role in making the MRI a reality today. Your support and dedication are all invaluable, and I want to give a very special heartfelt thank you to all the teams who have been tirelessly working behind the scenes. I also want to give a very special thanks to all of the community members who have shown generosity through the Headwaters Smart campaign. Together, they have donated over $6 million, which enables us to purchase, install, and operate our community's first MRI. Big round of applause. We would be remiss not to thank the Minister of Health and our MPP for Caledon Dufferin and the Ministry of Health for their commitment of more than $800,000 in annual operating funding for the first MRI in our region. And were it not for the generosity of so many individuals to bring this to life, our hospital could not provide the care that its patients come to expect and deserve. So this morning, we're honored to have several distinguished guests with us. I am pleased to welcome, and if you could just raise your hand when I call out your name, some Headwaters Health Care Centre Board of Directors. We've got Hugh Obrodovich, our past board chair, Dr. Paul Babin, Nim Nataraja, Lloyd Naronha, and the Mayor of Orangeville, Lisa Post, our Executive Director of the Hills of Headwaters Collaborative Ontario Health Team, Mr. Dave Pearson, our Chief of Diagnostic Imaging, Dr. Asad Naqvi, and there are many special guests from our Headwaters Foundation and the Smart Headwaters campaign, which I know are going to be introduced in a few minutes. And I also want to give a very special shout out to Matt Brown and his colleagues from SDI Canada who have worked with us tirelessly to bring this vision to life. We are now going to hear from just a few other key speakers who will share their insights and experiences. The Minister of Health and our MPP has certainly been no stranger to Headwaters over the last few months with a number of special announcements. Sylvia, your support of Headwaters in our hospital is invaluable. You've been with us as we've launched a new X-ray, a new CT scanner, and of course today. So it is my pleasure to welcome up our MPP for Dufferin-Caledon and the Honourable Minister of Health, Sylvia Jones.
Thanks, Kim. I think you just took all my speaking notes. It really is an honor to be able to be here. I whispered next door, it's really happening. You know, it is not lost on me, and I'm sure it is not lost on you as donors, as foundation members, that while the Government of Ontario funds the annual operating of an MRI, of course it is the community's generous gift that ensures that it actually is operationalized at Headwaters. So thank you very much for your support. Thank you for your commitment to Headwaters. Now, Kim mentioned there are a number of exciting initiatives that ensure Headwaters continues to provide exceptional care in our community. You know, as the Minister of Health, I have the honor of traveling from hospital to hospital, community to community, and there is no doubt that when clinicians have the diagnostic tools that they need to best serve their patients, that drives that motivation to stay in that hospital to continue to serve community. So as we see expansions of MRIs, Headwaters, of course, is one of 49 across Ontario that we have announced, and we have assured funding will be there when the community is able to provide and fundraise for the MRI. But those are 49 different MRIs that are either expansions or brand new, never had in their hospital, that are truly going to make a difference to patient care and, frankly, ensuring that patients and their families don't have that stress of having to move from hospital to hospital to get diagnosis to return for treatment. So I just want to thank you, congratulate Headwaters Foundation for the work that you've done. A huge appreciation and thank you to the donors who have stepped up to make this a reality, and I can't wait to have MRIs operating at Headwaters. Stay well, everyone.
Thank you very much, Minister Jones, and of course we deeply value your partnership. I would now like to introduce and welcome up Jennifer Zadravec, who is our Director of Clinical Support Services. Jennifer leads Headwaters Diagnostic Imaging Department, which will be the home of our new MRI, and she also oversees pharmacy and laboratory as well. Come on up, Jennifer.
Thank you, Kim. It's my absolute pleasure to tell you more about Headwaters' first MRI to the Dufferin-Caledon region. We are standing on the future site. We are standing on the future site of Headwaters MRI. To my right is our existing ambulatory care clinic, and behind me is our emergency department. This specific location was chosen to accommodate the electric and mechanical infrastructure requirements of our MRI. We consulted with engineers and our facilities department to assess the best options. When we're ready to open, we plan to deliver brain and spine, breast, musculoskeletal, and abdominal and pelvic MRIs. This variety of MRI scans will address the needs of our community. We look forward to offering even more MRI services in the future. In your handout, I believe most of you got it, you'll find the layout of the MRI area. This is the first time we've ever released details, and I'm excited to tell you more about it. The entire prefabricated unit is designed with optimal safety in mind, with specific zones from 1 to 4. These zones specify the level of increasing magnetic exposure. Zone 4 is the MRI room, which carries the strongest magnetic field. Our compliance with MRI safety regulations ensures that patients and our staff are safe throughout all zones of the MRI suite. So I'd like to tell you a little bit more about the MRI patient experience now. Once the patient is registered, they'll proceed to the MRI waiting room. There's a screening and changing room conveniently located in the waiting area. Once the technologist establishes the patient's safety and answers the questions they may have, the patient will then proceed to the patient holding area. This is where any pre-MRI preparation will be completed. We have 2 MR-compatible stretchers and 1 IV chair to support all clinical needs. And finally, when the patients are ready for their MRI scan, our staff will bring them into the innovative GE Healthcare Cigna Voyager machine. After the patient's scan, staff will escort patients back to the change area and answer any further questions they may have. We have extensively engaged all staff and volunteers and leaders on the changes to the interior of the cassette. Many stakeholders have been engaged in the interior design. This is including diagnostic imaging, lab, registration, and especially our patient and family advisor, Jamie Wilcott. She wasn't able to come today, but we really want to make a big thank you to her. As a representative of the Headwaters Patient and Family Advisory Partnership, Jamie plays an integral role by keeping the patient's experience top of mind. Thank you to everyone who's provided invaluable input to advise on the best possible decisions for our MRI suite. Very soon, Headwaters will be receiving the prefabricated building component called a cassette from SDI Canada. As a modular prefabricated unit, the addition allows for increased capacity while minimizing disruptions to daily operations during construction. Its turnkey, prefabricated modular design allows for significantly faster installation compared to traditional construction methods. The impact to patient care delivery and efficiency are immense. Quicker access to MRI means patients can receive timely diagnosis and treatment, potentially improving outcomes. Having access to accurate, timely diagnosis can lead to better patient outcomes and potentially save lives. All of this would not be possible without our teams. Thank you to the entire disciplinary team. Your experience across the different disciplines is critical to ensuring the success of our MRI implementation, and we can't thank you enough. This groundbreaking represents a very important milestone, and I'm delighted to share this with you. I'll now return the microphone. Thank you.
Thank you, Jennifer. It's nice for once someone's got more remarks than me. You did a great job. So now it's my pleasure to welcome up Casey Carruthers, who is the CEO of our Headwaters Health Foundation.
Thank you so much, Kim. Welcome everyone today to this very special morning. So back when I started with the foundation here, whenever the conversation turned to our desire to have MRI available for Headwaters patients, the conversation was dominated by 2 words, and those were hopefully and someday. And I think we were having those hopefully someday conversations pretty much every day at that point. You see, with literally thousands of patients having to travel out of the region every year for scheduled MRI tests, and then the double challenge if there's an emergency MRI required of having to find a hospital that can accept the patient and then sending a precious ER nursing staff along with them. The pressure for our own MRI here at Headwaters was building and building every year. And so in 2022, when our Minister of Health and local MPP, Sylvia Jones, came to Headwaters to announce support for MRI at Headwaters, it was like a dam bursting. The day that announcement was made, our phones were lit up with people in the community asking how they could help, how they could be part of it. They wanted to pitch in, contribute. People who had never contributed to the foundation before came forward, and our fundraising campaign took off. Leading the way, of course, in that effort was the Morningview Foundation. John and Margaret Roth and their family generously promised to match $3 million of community contributions with $3 million of their own. It was a historic pledge, and it's unsurpassed in the history of our foundation and hospital. Unfortunately, the timing wasn't great. John and Margaret are both out of the province today, but they assured me their spirit is here with us, marking this important milestone, and we are honored to recognize their leadership and generosity with the naming of the Morning View Foundation MRI Suite. Our Smart Headwaters campaign to bring MRI and more vital medical equipment to Headwaters Health Care Centre is ongoing, including the drive for the final matching million of the Morning View Pledge. I'm confident our community will rise to meet their challenge with generous hearts and well-earned pride in their community hospital. I'm also pleased to acknowledge Headwaters Health Care Foundation Board Chair Bill Duran, Vice Chair Tony Pringle, and our Smart Headwaters Campaign Chair Joan Wader, who are here today, along with fellow members of the Headwaters Health Care Foundation Board of Directors, including our Finance Chair and Treasurer Heather Evans, Audit Chair Karen Webster, Vince Borg, Jennifer Cruson, Thomas Harbaum, Sandra Hartman, Chris Stewart, Ann Thompson, Ed Upenix, and Kathy Yardley. These volunteer leaders have been fearless and tireless in their work, inspiring unprecedented philanthropic support for the hospital since the launch of our campaign 15 months ago. So on behalf of Headwaters Health Care Foundation and on behalf of every one of the thousands of patients and families who will benefit from this vital new diagnostic service at our hospital, I would like to thank everyone who has contributed to the Smart Headwaters campaign, the most ambitious campaign in the history of Headwaters Health Care Foundation. You have turned hopefully someday into today we celebrate. After years of dreaming, it is now a very real groundbreaking we are here for, and to announce the Morning View Foundation MRI Suite at Headwaters Health Care Centre. Thank you.
Thanks very much, Casey, to you and to your team and to the campaign and the cabinet. We are so appreciative, and you are such wonderful partners to the hospital. Before we conclude, I do want to extend our deepest gratitude to everyone who has supported bringing this MRI to Headwaters. Your commitment to improving patient care is truly inspiring. Thank you all again for being here today on this lovely morning. And I just want to give a cheers, I don't have a glass, but here's to an exciting new chapter at Headwaters. And so we are going to now officially break some more ground, and then we'll be happy to speak to the media. So I am just going to call up a few guests to break the ground with the very fancy gold shovels. There are going to be a couple of rounds of photos, but I will call the individuals up. So for the first photo, when I call your name, please head over to the table, pick up a hard hat and a lovely shovel, and come on over to the dirt pile. So our MPP, Minister of Health, Sylvia Jones, Hugh Obrodovich, past chair, the hospital board, Bill Duran, who's the Headwaters Health Care Foundation board chair, Joan Wader, who's the chair, the Smart Headwaters Campaign Cabinet, Casey Carruthers, who's the CEO of the foundation, Dr. Nagfi, who's our chief of diagnostic imaging, Jennifer Zadravec, who's the Director of Clinical Support Services, and Matt Brown, who's the Director at SDI.
Jennifer, you need some dirt.
Do I need to come on this side, Jennifer? Come on over. Balance us off. All right.
1, 2, 3.
Woo!